Today, we are going to talk about the correlation between intimate partner violence, IPV, and problematic substance abuse, or use, PS. Hello, and welcome to the first lecture of this course. In this session, I will give a brief overview of generally accepted counseling standards, basic principles, and skills. If you are a counselor or social worker, we believe you already know much of this, but I will highlight specific elements important for this course. In particular, we will be focusing on women survivors of intimate partner violence, which we will refer to as IPV, who have problematic substance use issues, abbreviated as PSU. We will discuss how to assess if a client is suitable for IPV and PSU counseling and how to do risk assessment. We will also talk about concepts such as the counseling cycle and management of therapeutic relationships. The first and most important principle that guides counseling is that the counselor's behavior should always be conditioned by empathy, compassion, and respect. However, remaining empathetic, compassionate, and respectful may often be a challenge while working with women survivors of IPV, especially when they are also dealing with PSU issues. This is due to the fact that these women often are difficult to work with due to their multiple traumatization, stigmatization, and marginalization. They may also be in denial or have a reluctance to seek or receive help. Instead, they often use coping strategies that are unhelpful or even dangerous. Additionally, professionals working with women survivors of IPV with PSU issues need to follow a non-judgmental approach. This includes having a listening ear and using a not knowing approach. Counselors should also be willing to learn more and be taught by their clients. They should avoid making assumptions or strong suggestions or recommendations. Additionally, IPV professionals need to be trained to show flexibility and ingenuity, be receptive to change, maintain balance within the therapeutic relationship, pose the right questions at the right time, provide the appropriate information, provide support, and instill hope. Several other principles of counseling are especially important when working with IPVs with PSU. The first is self-knowledge or self-awareness, which is defined as the individual's acquaintance and possession of genuine information regarding him or herself. Counselors should be aware of their capacities, abilities, skills, strengths, as well as their limits, fears, weaknesses, and blind spots. When working with women survivors of IPV, professionals should be fully aware of their attitudes and beliefs regarding violence, victimization, and perpetration, especially when these attitudes are caused by their own personal traumatic experiences. They should also be aware of their attitudes and beliefs towards PSU, including negative stereotypes about people with PSU issues. As the vast majority of IPV survivors are women, professionals need to be aware of their attitudes and beliefs towards gender-related issues. They should also explore and reflect their attitudes and beliefs towards different cultures and social classes, as many of the survivors of IPV that have PSU issues may originate from low socioeconomic levels and may belong to marginalized groups. Furthermore, counselors should not just accept their current attitudes and beliefs, but should constantly try to improve them over time. Another basic principle of counseling is that the client should have autonomy to think, decide, and act based in a free and independent way. Especially when working with IPV survivors, professionals should be very careful as these women have been ruled by others for a long period of their lives. As a matter of fact, the autonomy developed during counseling is one of the main goals of IPV and PSU therapy, due to the low self-esteem and stigmatization suffered by these women. It is important to note that self-knowledge and client's autonomy constitute two correlated issues. A counselor's personal motivations affect their ability to provide adequate help and by extension, their ability to foster clients' autonomy. Through self-knowledge, IPV professionals are able to separate helpful from harmful motivations. For example, although being a positive motivation, a desire to help others may become a harmful practice if it is used to make the client dependent on the counselor in order to raise the counselor's self-esteem. Another crucial issue related to self-knowledge is the psychological pain of the counselor. Some professionals choose counseling careers due to their personal experiences of mental health issues and trauma. Studies have shown that therapists might be motivated to enter this profession due to feelings of isolation, loneliness, and sadness, as well as the presence of traumatic experiences mainly felt during childhood. As a result, counseling may be used by these professionals as a means to find answers for themselves and fulfill their unmet needs for attention and intimacy. In the PSU field, there are many therapists who have personal experiences of substance abuse in their past. This is mainly due to the 12-step approach and philosophy of Alcoholics Anonymous. In fact, it is estimated that close to 1/2 of therapists working in PSU services have recovered from addiction. Such personal experiences may lead to intense and indistinguishable identification between the counselor and the client, which can violate therapeutic boundaries. Regarding IPV and violence in general, such motives may be extremely dangerous when the counselor's unprocessed trauma is triggered by client experiences. The next counseling principle is non-malfeasance. This is considered a non-negotiable principle, as all professionals have the obligation to not harm their clients. However, in many complex cases, such as in co-occurring IPV and PSU, it is difficult to define where to draw the line between benefit and harm, since this assessment is based on subjective evaluation and as such involves the risk of paternalism. Another basic principle of counseling is justice, according to which all clients should be treated equally. This is especially important for women survivors of IPV with PSU issues. Justice and non-discrimination inside the therapeutic relationship is a helpful experience for deconstructing long-term discrimination felt by the client. All counselors have the responsibility to manage the therapeutic relationship and set clear rules and boundaries. Not setting boundaries can lead to client dependency on the counselor, which might result in less successful treatment outcomes. There are several ways in which a counselor can set boundaries with the client. First of all, there should be clear boundaries regarding the duration of the session and the availability of the counselor. For example, when the client can call them. Time limits should also be clear and not exceeded. Second, discussions about other clients or about counselors' issues are not acceptable, even if relevant. Third, the counselor should never accept or offer gifts to the client, neither any kind of services, or use for their own benefit any information given by the client. Fourth, physical contact with the client should be avoided, especially when working with women survivors of IPV. Professionals should be very careful to avoid physical contact, as it may be perceived as intrusive and/or abusive. It could also trigger negative emotions or flashbacks of traumatic experiences. Finally, multiple relationships between counselors and clients should be avoided, not only during therapy, but also after its termination. This includes situations such as being friends or work partners. Professionals should also avoid counseling their own relatives or close friends. They should also avoid being a client's counselor and supervisor at the same time. In other words, they should avoid emotional and sexual involvement completely. There are also ethical issues that need to be considered. The first and most significant is the client's right to anonymity and confidentiality. Confidentiality is a fundamental aspect of therapy, as it is the basic condition for the implementation of the therapeutic relationship. Confidentiality concerns all information about the client's personal, sexual, professional, and family life, as well as experiences of her family and their close social relationships. It also includes aspects of inner self such as habits, thoughts, opinions, expectations, fantasies, fears, vulnerabilities, and desires. Client anonymity and confidentiality should be ensured by all professionals working in the IPV and PSU fields. Exchange of information between corresponding professionals and services should be in line with this principle and follow clear guidelines. Personal data should also be anonymized and kept in a safe place. The client should be informed both orally and in writing when confidentiality might be broken. However, it must be clear to all professionals that confidentiality must be broken in specific occasions, such as suicide ideation and danger for one's life. The counselors should be absolutely sure of the existing danger in order to break confidentiality, because in this case, the principle of client's autonomy is fully broken. For this reason, risk assessment is crucial while working with women victims of IPV with PSU issues due to IPV re-victimization or PSU-related risks, such as overdosing. It is important for professionals to keep in mind that only the people that could act and prevent the harm are the ones that should be informed. For example, the police or a possible victim. In any case, the client has to be informed about the confidentiality breach, and if possible, their consent should be obtained. In order to support survivors of IPV with PSU issues, counselors should have the capacity to assess and manage crisis situations regarding both IPV and PSU. They need to have appropriate skills to promptly evaluate possible risks. Based on the risk assessment, counselors afterwards define the essential goals and actions. Risk and crisis management regarding IPV includes prevention of additional violence, re-traumatization, and disclosure of the traumatic incident. For PSU, risk assessment and crisis management include harm reduction, prevention of overdose, and relapse. This will be covered in more detail in Module 6. To assess the client's suitability for IPV and PSU counseling, professionals should do the following. First, they should identify current symptoms for IPV and PSU, then assess the client's motivation and willingness to change. They should also assess the ability of the client to focus on herself and consider if she is an appropriate referral for this service. If there are any doubts, professionals should consult their coordinators or supervisor. They should also make a screening for other possible health issues, including mental health, comorbidity, medication, or suicide attempts. When it comes to the counseling cycle, it is very important for women survivors of IPV with PSU issues to feel safe and protected during the very first contact in order to commit to the counseling procedure. Professionals, regardless of their experience, should always be prepared for their first meeting with the client. The counseling environment needs to be welcoming and friendly. For example, it should be ready, clean, warm, quiet, and without any IPV or PSU triggers. The counselor should introduce themselves to the client and then set a framework with clear boundaries. They should also provide adequate information regarding the process and intervention in a simple and understandable way. The counselor should address the basic principles of client confidentiality and the possible occasions when it can be broken. Then the client should be asked to sign the agreement form. Afterwards, the counselor should focus on the reasons why the client is looking for help and ask about their expectations regarding therapy. At this point, it is good to keep in mind that discussing all possible issues at once is not necessary, and the pace can slow down. The client needs to be reassured that there will be plenty of time to discuss any concerns that she might have. To make counseling more efficient, professionals need to follow some additional principles. The first step towards this is building trust and understanding in the therapeutic relationship. As I described before, women survivors of IPV with PSU may face additional challenges, which complicates building of trust. In order to trust the counselor, safety is crucial for women survivors. Women need to feel that they are believed, that they are not to blame, and that they are not alone. Ideally, the IPV professional would be perceived as a genuine, warm, empathetic person who truly cares about the client. In order to address the client's internal feelings of stigma, counselors should communicate that all individuals are essentially good, that no one is born bad or evil, and thus all clients can get help. The desire to change is defined as a counseling goal and framed as a positive development. The basic condition for this to be achieved is the client's wish to be helped. However, at this stage, professionals should also communicate to clients that change involves struggle and possibly pain. In terms of effective communication, the language used by the counselor should be simple and easily understandable. It should correspond to the client's level of understanding and avoid excessive scientific terminology. When the use of the terminology cannot be avoided, or when the discussion requires complex terminology, counselors should regularly ask for feedback to make sure they have been understood correctly. Professionals who work with women survivors of IPV with PSU should use a gender-sensitive language without stereotypes. When it comes to counseling skills, professionals can use many different techniques. One of them is reflecting. When counselors paraphrase and reflect the discussion's context as well as the client's feelings. Through reflection, professionals check if they understood the client correctly and if the feelings shared by the client are in line with their self-perception. This facilitates the client's self-awareness by helping her to listen carefully and reconsider the meaning of what she just said. By reflecting feelings, the counselor expresses their willingness to accept clients' emotions and enables her to vent these feelings as well. According to the principles of effective reflection, emotions are to be recognized, characterized, and addressed. The reflection technique can highlight the differences between verbal and nonverbal communication, so special attention should be paid to mixed or ambiguous emotions. To clarify certain topics, phrases, or emotions, counselors can use either encouragement or paraphrasing. Encouragements include verbal and nonverbal prompts. Verbal prompts could be short expressions, repetition of one or two keywords, repetition of the exact words of the client's last phrase followed by silence, which is also referred to as response latency time. Nonverbal prompts could be the processing of body communication, such as visual contact, tilt of the body forward, or other appropriate gestures. Another counseling skill worth mentioning is psychoeducation and information. This can lead to the clarification and deconstruction of myths clients may have about their experiences. Psychoeducation and information about IPV and PSU can normalize the experiences, thoughts, and feelings of the client. This happens because they provide an idea that all survivors with PSU issues face similar challenges. These empowerment methods can be used as good practices, offering ways to ensure safety from IPV and PSU, making recovery feasible. Psychoeducation could include the provision of community and other relevant resources, offering options that may have previously seemed out of reach to the client. Another counseling skill that we are going to discuss is feedback. Providing effective feedback to clients should follow some specific rules. All feedback and remarks should include both positive and negative points. The IPV counselor should not make comments about the client's behavior that expresses their impression of her. They should also describe what they observe or feel instead of judging or assuming why something has happened. For example, a counselor should say, "Your voice scared me," instead of saying, "Shouting is awful. You raise your voice because you are mean." Additionally, counselors should express their own thoughts, emotions, or beliefs and not speak on behalf of others. For example, it would be okay for you to say that you think something, but it would not be okay to say that everybody thinks this way. Furthermore, the feedback should be about specific circumstances and behaviors and not generalizations. For example, it would be okay to say, "When you did this, you made me upset." However, it would not be appropriate to say, "You always make me upset." Another useful counseling technique falls under the category of attention skills. To establish a trusting therapeutic relationship, professionals should pay attention to clients. This can be done by maintaining visual contact, but sometimes looking elsewhere to make the client feel less awkward or violated. It can also be done by having relaxed and friendly body language that shows interest and acceptance. Counselors should keep in mind that body language constitutes 85% of communication. Counselors should also use an appropriate vocal style, including low speech rate, volume, and tone. Finally, counselors should demonstrate that they are paying attention by trying to minimize unnecessary interruptions. A counseling technique that goes hand in hand with attention skills is active listening. This is also done to ensure a client's comfort during the therapeutic session. Professionals can open the floor for discussion by combining open and closed questions. Open questions encourage clients to express themselves and to elaborate more on the topic. For example, you could say, "What would you like to discuss today?" Or, "Could you tell me more about that?" Closed questions, on the other hand, help counselors to gather specific information and makes clients speak about matters that the counselor is interested in exploring more. However, when using closed questions, it is important to avoid directional, guiding, or complex ones. Summarizing is a technique used by counselors to clarify the essence of what the client has said. It is a careful observation and selective repetition, with as much accuracy as possible, of the client's statements and behavior. Summarizing should also emphasize both the verbal and nonverbal messages of communication. Summarizing is more extensive than paraphrasing or reflecting, and usually includes a greater range of emotions or topics that has been presented in one or more sessions by the client. Through summarizing, professionals can detect and highlight repeated patterns that arise, as well as the inconsistencies and polarization of the client's emotions. While summarizing, counselors remain open as the client might want to add or correct something. Another important technique that we are going to discuss is self-disclosure. The counselor's self-disclosure is defined as intentional verbal statements that reveal personal information, elements, and aspects of a counselor's experience and life. Self-disclosure can be divided into several categories, such as disclosure of facts, feelings, insights, or strategies. Self-disclosure may induce positive consequences, as it enables empathy and compassion, provides validity, brings new knowledge and perspectives, reduces shame, and facilitates building of trust between the client and the counselor. However, self-disclosure may also include risk, raise concerns, and induce negative consequences. The counselor's self-disclosure may move focus away from the client. The counselor can be also seen as a weak or unstable person. In any case, self-disclosure can be an ethical dilemma. If used, it should be done very carefully, with sensitivity to clients' responses and consultation with the supervisor. Counselors' supervision is crucial when working with survivors of IPV with PSU. Supervision will help to deal with possible emotional and professional challenges. It can also help counselors to make ethical and adequate decisions concerning the dilemmas that were previously described. We will talk more about supervision and assessment of treatment in our last module in this course. Finally, it is worth noting that in regards to the counseling cycle, every therapeutic relationship has its beginning and it has its end. It is very important to prepare for the closure of the counseling cycle when it is approaching. Counselors have to be sure that all the main issues regarding both IPV and PSU have been sufficiently addressed. It especially concerns those aspects that have previously put survivors of IPV with PSU in danger or made them suffer. Clients usually go through the process of managing stigmatization and marginalization while broadening their supportive networks and improving their social skills. All of this might be challenging to process, so that for some clients, termination of therapy resembles loss and mourning. Counselors should ensure that the clients are prepared for those feelings to arise. Follow-up sessions are recommended to smooth the transition period. This is it for today's lecture. Thank you for watching. In the next module, we are going to focus more on the correlation between IPV and PSU. So do not forget to complete the assignment to get access to it. Thanks and goodbye.